also need to make sure we keep our fiscal house in order. Let's get on with it. Let's go ahead and deal with these tough issues. Let's solve this problem for this year and move on to the longer-term issue. Madam President, I thank you. To the Senator from Vermont, I thank you for your courtesy, and I yield the floor.
The
Senator from Vermont is recognized.
Madam President, I would call up I'd ask unanimous consent to set aside the pending amendment.
Without objection, so ordered.
And Madam President, I ask consent to bring up and pass Amendment 132, the Cardin-Landrieu amendment.
The clerk will report the amendment.
What? He asking.
You should object.
Do we report, tell me something, do we report it first and then we object, or we object to even the reporting of it?
Let me
say report the amendment.
The Senator can object to laying aside the pending amendment.
Okay, Madam President, I would object on behalf of Senator Coburn of Oklahoma.
The objection is heard.
Madam President, I would, to make it clear, to ask consent that we revert to the pending amendment, which I believe was a Leahy amendment.
Is there objection? Without objection, so ordered.
Madam President, I suggest the absence of quorum.
Did we not ask for objection? The clerk will call the roll.
Mr. Akaka.
Mr. President, is the Senate presently in a quorum call?
Yes.
Mr. President, may I ask that the pending quorum call be vitiated?
Without objection.
Thank you, Mr. President. Mr. President, I'm here today to speak about a report that was released by the Center for Disease Control, which I think is instructive for the American healthcare system. We are currently in a process of change in healthcare, changing the way that healthcare is delivered in our country is going to take years of hard work, of experimentation, and of learning. There are stakeholders on both the federal and state level who are out there right now working to implement models of care that increase the coordination and efficiency with which health care is delivered, improve the quality of the care that is delivered, improve the outcomes that patients experience, and control costs, bring costs down. This delivery system reform is the real issue of health care reform in our time. And I emphasize it is a win-win for our system, improving the quality of care while lowering cost for the system. This report, called Vital Signs, released this week by the Center for Disease Control, illustrates how just one type of quality reform, reducing hospital-acquired infections, has already improved health outcomes and resulted in significant cost savings. Hospital-acquired infections are a tragic reality of our healthcare system. Nearly 1 in every 20 hospitalized patients in the United States is affected by a hospital-acquired infection each year. The most deadly of these infections occur when a tube inserted into a patient's vein is either not put in properly or not kept clean. Bloodstream infections resulting from these tubes, what are called central line infections, kill as many as 1 in 4 patients who become infected. I suspect if we sat all the members of the Senate down, there would be very few of us who could not identify a friend, a loved one, a family member, somebody we knew who had not been exposed to a hospital-acquired infection. The deaths from hospital-acquired infection are not only numerous, but tragic, and particularly tragic because they are largely preventable. These are what should be considered a zero event. Studies have shown that when providers follow a strict checklist of very basic instructions, including things as simple as washing your hands with soap, cleaning a patient's skin with antiseptic, and placing full sterile drapes over the patient, those rates of hospital-acquired infection plummet. The CDC's Vital Signs report is further evidence of just how effective these guidelines are at reducing, and in some cases nearly eliminating, central line bloodstream infections from intensive care units. The report's findings show that from 2001 to 2009, state and federal efforts to promote and adopt CDC guidelines and best practices for preventing hospital-acquired infections contributed to a 58% decrease in the number of central line bloodstream infections among ICU patients. 58% decrease in just 8 years from 2001 to 2009. Now, a percentage is a fine thing. It's a statistic, but it doesn't have a lot of meat on its bones. So what does this 58% really mean? It represents up to 27,000 lives saved. 27,000 families who got their loved one home from the hospital instead of having that terrible conversation with the doctor explaining to them why their loved one passed away. And if that were not enough, it also represents approximately $1.8 billion in cost savings to our health care system. 27,000 lives and $1.8 billion saved from reductions in just one type of hospital-acquired infection in just one type of care setting. The promising news from the CDC report is that the steps healthcare providers are taking to prevent this type of infection are working. The bad news is that we're not doing enough to reduce the occurrence of bloodstream infections in other healthcare settings. The report found that in 2009, approximately 60,000 central line bloodstream infections occurred in non-intensive care unit settings, like hospital wards or kidney dialysis clinics. This should not be acceptable to us, especially given the tools that we know we have to prevent these infections from happening. Simply put, we can do better. We can save more lives. We can improve the quality of care that people receive, and in the process save billions of dollars in our health care system. The CDC is already working to support partnerships between healthcare providers to more broadly implement these now proven quality reforms. This is a good start. Mr. President, in my home state, I have very proudly watched the Rhode Island Intensive Care Unit Collaborative, a partnership of healthcare stakeholders led by an organization called the Rhode Island Quality Institute, take the lead in implementing similar quality reforms to reduce the rate of hospital-acquired infections in our intensive care units. Rhode Island is the only state in the country to have 100% of its adult intensive care units participating in a collaborative of this kind, and I would commend it to any one of my colleagues. It began years ago in Michigan with the Keystone Project. It spread across the country through the Pronovost principles, and in Rhode Island we've really run with it. It has only been a few years, but the results, much like those reported by the CDC, are eye-opening. And I'll quantify this by saying that we began with very first-rate hospitals in Rhode Island. We are in that high-tech northeast corridor. We're near the Boston medical centers. We are starting from a very high base of care in Rhode Island hospitals. But even from that good base, the collaborative recorded significant improvements in two types of deadly infections: central line bloodstream infections and pneumonia among patients on ventilators. The collaborative estimates that from 2007 to June 2010, just over 3 years, the effort had saved 73 intensive care unit lives, 73 lives of intensive care unit patients. It eliminated the need for over 3,200 expensive hospital days, and it saved hospitals, patients, and insurers $11.5 million. This evidence underscores the potential for similar types of delivery system reforms which, by improving the quality of care, lower the cost. An array of different strategies can lead to these savings. Quality reforms like this that avoid errors and adverse consequences. Prevention programs that save lives and money by getting in there before the disease takes off. A robust health information infrastructure that allows for safer and better coordinated care between your primary health care provider, your specialists, your imaging place, the laboratory, the hospital where you had to be admitted. Payment policies that reward better results, not just more procedures. And finally, better administrative efficiency so that more health care dollars actually go to health care instead of being burned up on bureaucracy and battles over who gets paid and all the rest that weighs down our health care system. The President's Council of Economic Advisors noted recently that up to 30% of health care costs, or about 5% of GDP, could be saved without compromising health outcomes. 5% of GDP is around $700 billion. $700 billion a year saved through this kind of win-win is a target worth fighting hard to achieve. I agree with the Council's observation, but from my experience, I think that we can achieve these savings not just without compromising health outcomes. I think we can achieve these savings while improving health outcomes. Implementing these reforms and achieving these savings won't be easy. It's not just flipping a switch. It's a journey. And that journey will have turns and it will have obstacles. It is a process, as very expert reviewers have said, of learning, of experimentation, of adaptation. But we've been down paths like that before with great success. And the evidence that I've presented today shows how well it can work in health care. So I urge my colleagues, I urge the administration and state leaders to continue working together in all of these areas to make reforming our health care delivery system a priority. The future of our health care system and the good health of our constituents and the good health of our country's fisc all depend on it. I'll conclude by saying something that I've said before, which is that I give great credit to the Obama administration for working in this area. I believe that our health care reform bill put every possible pilot, experiment program, model for testing these different types of delivery system reform on the table. Very expert reviewers have looked at it and said, I can't think of a thing they didn't try. Everything is in there. And on top of that, the Obama administration has put first-rate people who really get this side of the equation, people like Don Berwick and David Blumenthal in charge. So a lot of very good things have lined up to take full advantage of these kind of win-win savings. The only thing that I think is missing is that the administration has not yet set a hard goal for itself to hit. It still talks about bending the health care cost curve. Well, fine, but that's not a measurable goal. I suspect that if years ago we're coming up, I think, on the anniversary of President Kennedy's pledge to put a man on the moon, if way back then, when we feared losing the space race to the Soviet Union, if the President of the United States had then said, I'm committed to bending the curve of the rate of America's space exploration, that would have been an unmemorable and an ineffective presidential intervention. Instead, President Kennedy put a hard benchmark out there that everybody in the world would know we had failed at if we missed it, and that was to put a man on the moon within a decade and bring them home safely. We didn't know then how we could do it. We believed we could. We're optimists. We're innovators. This is the country of innovation and of the big idea. And by putting that marker out there, President Kennedy drove what was then a smaller federal bureaucracy towards that goal. And I think we need an equally specific goal from the administration on this front in order to make sure that our considerably larger federal bureaucracy is fully purposed towards achieving that, because the goals are going to be so significant. So I congratulate the CDC on their report. I want to remind my colleagues how valuable this kind of health care reform is. It's not what we yell about here, but it's out there right now saving lives and saving money, and we need to encourage it, and we need to expand it, and the more the administration can put a hard goal out there for itself, the quicker we will get where we need to be, to the great benefit of ourselves as a country and our individual fellow American citizens. I thank the presiding officer, and I yield the floor.
Shouldn't he have asked? What he needs to say.
President,
Senator from Rhode Island.
Mr. President, I understand we have some parliamentary business for me to attend to in a moment. And while we're waiting for that, I'd like to just take an additional moment to speak in support of legislation that I've introduced with Senators Jack Reed of Rhode Island, Merkley, Sanders, and Tester to enhance foreclosure protections for service members and their families and to help ensure that their rights under the existing Service Members Civil Relief Act don't get violated. I think everybody in this chamber has heard horror stories about how the servicers that took over the loans for the big banks that were chopped up into strips and sold to the four winds now treat homeowners in distress. These abusive practices are bad enough, but when these abusive practices harm the men and women who are sent into harm's way to protect our country, it is a particular shame and a particular tragedy that deserves our urgent attention. These practices are not only illegal and morally repugnant, but dangerous distractions from our country's military mission. Holly Petraeus, General Petraeus' wife, leads the Consumer Financial Protection Bureau's Office for Service Member Affairs, and she testified on this issue during a recent hearing before the House Veterans Affairs Committee that it is a terrible situation for the family at home and for the service member abroad who feels helpless. Service members over at the point of the spear in Afghanistan have enough to worry about without worrying about the bank foreclosing on their family. According to recent media reports, it's come to light that financial institutions have repeatedly failed to comply with the Service Members Civil Relief Act, or the SCRA. These violations led to thousands of mortgage overcharges and a number of unlawful foreclosures. Under the SCRA, it is illegal to foreclose on a protected service member unless an authorization by a judge is obtained. Then, the judge can only act after a hearing is held in which the military homeowner is represented. One of the most troubling cases is the story of Sergeant James B. Hurley, who lost his home while he was serving in Iraq. Like many reservists, Sergeant Hurley made less money serving on active duty than he did in his civilian job. So when he was mobilized, it became a real struggle for his family to afford his mortgage, and they fell behind in making those payments. The SCRA was designed to protect our service members from just that kind of financial challenge, and it should have prevented the bank from foreclosing on Sergeant Hurley. However, the bank violated the SCRA, foreclosed on Sergeant Hurley illegally, and forced his wife and children out of their home. Sergeant Hurley returned from combat as a disabled veteran to find that the bank had sold the home that he had worked so hard to build. Our current economic climate has hit our returning veterans particularly hard, adding to the financial challenges our deployed service members already must face. According to a recent Department of Labor report, the unemployment rate for veterans rose to 9.9% overall and 15.2% unemployment for veterans of the wars in Iraq and Afghanistan. These heartbreaking statistics underscore how difficult it can be to readjust economically to life at home, how disruptive that interruption in a career can be. For our returning service members that need time to get back on solid financial footing, to need to rebuild what they had to walk away from to defend the rest of us, we should do everything we can to accommodate their needs, especially during these difficult economic times. My Protecting Service Members from Mortgage Abuses Act of 2011, which I'm introducing today, would encourage compliance with the SCRA by doubling the maximum criminal penalties for violations of its foreclosure and eviction protections. It would also double civil penalties in cases where the Attorney General has commenced a civil action against the lender. In addition, the bill will give service members the time they need after returning from deployment to regain that solid financial footing by extending the period of foreclosure protection coverage from 9 to 24 months after military service has ended. I hope that senators on both sides of the aisle can come together and join me in supporting this legislation to discourage loan servicers from further violations and help to protect the financial well-being and the emotional well-being of our troops. Mr. President, I will now ask unanimous consent to set aside the pending amendments and, on behalf of Senator Bingaman, call up amendment number 142.
Is there objection? Without objection, the clerk will report.
The Senator from Rhode Island, Mr. Whitehouse, for Mr. Bingaman, proposes an amendment numbered 142.
Mr. President, I ask unanimous consent to dispense with further reading of the amendment. It is my understanding that this amendment is agreeable to both sides, and therefore I ask for its adoption.
Without objection. The amendment is agreed to.
Thank you, Mr. President. I yield the floor.
Mr. President.
Senator from Vermont.
Mr. President, as you well know, Congress is now engaged in a debate of huge consequence, and that is the budget. And the budget of a nation, like the budget of a family, expresses who we are as a people and what our priorities are. Where you spend your money, where you make your investments, tells you everything about what we believe in. I am more than aware that this country faces a $1.6 trillion deficit and a $14 trillion national debt. And these are enormously important issues, but they're issues that have to be dealt with in a sensible way, and they're issues that have to be dealt with within a broader context. So I think the very first question that we have to ask, Mr. President, is how did we get to where we are today? Is the problem, in fact, that we spend too much money on Head Start and child care, that we just shower so much on our children, or is the converse the truth, and that we have the highest rate of childhood poverty of any major country on earth? How did we get into the deficit? Well, let me tick it off. And when we discuss how we got into the deficit situation, the irony here is that those people who are yelling loudest about the deficit, who are fighting hardest to make savage and draconic cuts on basic programs, are precisely the people who led us to where we are today. Mr. President, I voted against the war in Iraq for a number of reasons, one of them being that it wasn't paid for. Do you happen to recall, as we went into the war in Iraq, which will end up costing us about $3 trillion by the time we take care of our last veteran, do you recall much discussion about how that war was going to be paid for? In fact, do you remember one word of how that war was going to be paid for? I don't remember that. I was in the middle of that debate. $3 trillion, and no one said, oh, we can't afford it. Mr. President, when the crooks on Wall Street, through their illegal behavior, their reckless behavior, drove this country into the recession we are in right now, and they came begging to the Congress for their welfare check of some $800 billion, do you recall too many of the people who voted for that saying, gee, we can't afford to do it. It's going to drive up the deficit. How are we going to provide Wall Street with an $800 billion bailout? I don't recall that discussion. And when I was in the House a number of years ago, Congress passed an initiative from President Bush for a Medicare Part D prescription drug program. I believe that seniors must have prescription drugs, but not that legislation, which was written by the insurance companies and the drug companies, and it was not paid for. When our Republican friends fought vigorously for tax breaks for billionaires, which would result in significantly less money coming into the Treasury, driving up the deficit, do you recall much discussion about how we were going to pay for that? I don't recall that discussion. So I find it ironic that when you give tax breaks to billionaires, no worry about the deficit. When you bail out Wall Street, no worry about the deficit. But suddenly, when you provide child care to low-income children who are in desperate need of help in the midst of a recession, suddenly everybody is concerned about the deficit. Frankly, Mr. President, I call that absolute hypocrisy. It is hypocrisy to say that we can give tax breaks to billionaires and not worry about the deficit, but we have to cut back on the needs of working families, the middle class, the sick, the poor, the elderly. Mr. President, this country at this particular moment has got to make some very basic decisions. And the decisions that we make are whether in the midst of this horrendous recession, when the middle class is hurting, when poverty is increasing, do we really go after, as our Republican friends in the House want us to do, programs that are virtually life and death for millions and millions of working class and lower income people? Now, Mr. President, I don't know about West Virginia, but I can tell you that in Vermont it is very, very hard for working families to get adequate and affordable and good quality child care, early education for their kids. It is a major, major problem all over this country. And yet our Republican friends say we should balance the budget by cutting Head Start $1.1 billion, a 20% cut from 2010, and throwing over 200,000 kids off of Head Start. Now, if you're a working mom who sends your kid to Head Start now, feels pretty good that your kid is getting a good quality early childhood education, getting nourishment. They feed the kids. They watch these kids for health care problems. We're going to throw over 200,000 kids off of Head Start. Mr. President, I work very hard to expand the Community Health Center program, which I know is so important in West Virginia and Vermont. You and I argue about which state has greater coverage, but it is enormously important all over this country. A few years ago, about 20 million people were accessing Community Health Center program. We are now working so that in 5 years, 40 million Americans will be able to walk in the door regardless of their income, get health care, dental care, low-cost prescription drugs, mental health counseling. It is working. President Obama has been very, very strong on this issue. Secretary of HHS, Kathleen Sebelius, has been very, very strong on this issue. It is working. And here's the irony. When we give people good quality primary health care, they don't have to go to the emergency room. The emergency room costs 10 times more than treatment at a community health center. When you open the doors for primary health care, people will not get very sick. They don't end up in the hospital. Study after study shows that when you invest in community health centers, you save the taxpayer money. You save Medicaid money. You save Medicare money because people have access to medical care when they need it. The Republican House wants to cut community health centers by $1.3 billion, denying 11 million Americans the opportunity to receive the health care that they need. Mr. President, in my office, and I'm sure all over this country, people who are applying for disability help, for Social Security, are upset about how long the process takes. Our Republican friends want to make major cuts in the Social Security Administration, which means that 500,000 people are going to find delays in getting their claims processed. Everybody in America knows that one of the great problems that we face is the expense of college. We know that hundreds of thousands of bright young people can't even afford to go to college. We know that many people are graduating college deeply in debt. And one of the accomplishments that we've managed to bring about in the last few years is to significantly expand the Pell Grant program so that low and moderate income families would find it easier to send their kids to college. Our Republican friends in the House have decided in their wisdom that what they want to do is reduce by 17% Pell Grants, which means that 9.4 million lower-income college students would lose some or all of their Pell Grants. Here we are trying to compete with the rest of the world. We are falling, in many cases, further and further behind in terms of the percentage of our young people graduating college. College costs are soaring, and the Republican solution is to cut the major program, which makes it easier for working families to send their kids to college. Community Services Block Grant Program is the infrastructure by which we get emergency services, food, help to pay for emergency services for lower-income people, housing needs, making sure that people keep the electricity on. That would be decimated by the Republicans. In the midst of a recession, what they want to do is to cut $2 billion from the Workforce Investment Act and other job training programs when we desperately need that job training to make sure that our people can get the jobs that are out there and are available. And often they don't have the skills to do that. My point, Mr. President, is a pretty simple one, that as a nation we've got to make some choices, and here are the choices. The top 1% today are doing phenomenally well. That's the fact. Our friends in Wall Street, whom we bailed out, are now making more money than they did before they caused this recession. Top 1% now earns about 23% of all income in America, more than the bottom 50%. The top 1%, the richest people in America, in terms of their effective tax rate, what they really pay, is now lower than at any time in memory. So you got the wealthy doing phenomenally well, tax rates going down. We have showered huge tax breaks on them, and then we say to balance the budget, we have to cut programs for nutrition for our kids, Social Security Administration, Pell Grants, Head Start, and many, many other programs which millions of people depend upon. So the question that we as Americans have got to decide is, when the rich get richer, do we give them more tax breaks while the poor get poorer and we cut programs for them? Well, I don't think, frankly, that that is what the American people want. Mr. President, you may have seen there was a poll just came out. I think it was yesterday or today. It was an NBC News and Wall Street Journal poll. And the questions dealt with the deficit and how the American people think we should go forward in dealing with the deficit. And here are some interesting results. When asked what do Americans want the federal government to do to reduce the deficit, the largest, highest percentage came down in saying that it is totally acceptable or mostly acceptable to impose a surtax on millionaires to reduce the deficit. 81% of the American people said that, for obvious reasons. Rich are getting richer. Given the choice to ask people who have received huge tax breaks, already doing very well, to pay a little bit more in taxes or to cut programs that working families need, the choice is not terribly hard. 74% of the American people believe it is totally acceptable or mostly acceptable to eliminate tax credits for the oil and gas industry. 68% of the American public believe it is totally acceptable or mostly acceptable to phase out the Bush tax cuts for families earning over $250,000 a year, et cetera, et cetera. So what the American people are saying in this poll, and I believe all over this country, is kind of obvious. Given the choice of decimating programs that working families depend upon, or asking the wealthiest people in this country who have been receiving huge amounts of tax breaks to start paying their fair share, it ain't a tough answer. And the answer the American people are saying is, you cannot move toward a balanced budget just by cutting, cutting, and cutting. A budget has two parts. Everybody in America understands that. It is the money you spend, It is the money that comes in. And in the case of the United States government, we have got to address our budget deficit in both ways. We have to raise revenue, and you do that, I think, primarily by asking the wealthiest people in this country to pay a little bit more in taxes. And yes, you do have to cut some programs. I think there's waste out there. I think there are programs that can and should be cut. That's what you do. You don't just cut, and then give tax breaks to the very wealthiest people in this country. Now, Mr. President, we have, as the Senate, along with our friends in the House, the responsibility, the constitutional responsibility of coming up with a budget. And I certainly hope that the President intends to play an active role in this, and I hope that the President is prepared to do the right thing and to understand that revenue, asking the wealthiest people in this country to start paying their fair share of taxes, is one important component of how we move forward toward a balanced budget. But if the President chooses not to participate, or if the President chooses not to take that avenue, that does not mean to say that we in the Senate should not go forward. So I would hope, Mr. President, and I intend to work as hard as I can to come up with a deficit reduction program which is fair, but which is responsible. And being responsible means it includes revenue and not just cuts. And there are a whole lot of ways that we can bring in revenue in a fair and progressive way. It's not only asking the wealthiest people in this country to pay their fair share of taxes, it's ending abusive and illegal offshore tax shelters. Do you know that according to a number of studies, we will lose $100 billion this year because corporations and wealthy individuals are stashing their money in tax havens in the Cayman Islands and in Bermuda? Well, you know what? Before you cut nutrition programs for pregnant women, maybe we do away with those tax havens, you know? Mr. President, we have got to begin the process of ending tax breaks for big oil and gas companies. ExxonMobil, the most profitable corporation in the history of the world, not only paid nothing in federal income taxes in 2009, but they received a $156 million tax refund from the IRS, according to their own shareholder report. Well, maybe before you start cutting the Social Security Administration or Pell Grants for college students, maybe, you might want to ask the most profitable corporation in America to start paying some federal income tax. And on it goes. So my point, Mr. President, is now is the moment when we have got to do the right thing for working families in America, and that is to understand that there's a lot of pain out there. A lot of people are hurting. This recession has taken a very heavy toll. And in the middle of these tough times, you don't stick a knife into people and make it even worse. So we have got to move to a deficit reduction. I believe that. But I believe you don't do it on the backs of the sick, the elderly, the poor, and the most vulnerable people in this country. I think we need a little bit of shared sacrifice here, and some of the wealthiest people in this country are going to have to play their part in deficit reduction as well. With that, Mr. President, I would yield the floor, and I guess I won't yield the floor here. Okay, what do we got? Mr. President, on behalf of the Majority Leader, there will be no further roll call votes today. The next roll call vote is expected on Monday at 5:30 p.m. And with that, I would yield the floor and note the absence of a quorum.
Clerk will call